I'm Vicky Cleek and I'm a consultant psychiatrist with a special interest in ADHD, and this is the next video in a series for women particularly who are thinking about getting a diagnosis of ADHD or have recently been diagnosed with ADHD. It comes along with my free to download Women's Guide to ADHD Mastery, finding out who you are without ADHD, and that can be downloaded from my website, which will be at the end of this video. The Women's Guide to ADHD Mastery is there to help women adjust to a diagnosis of ADHD and to really pull apart who they are from the ADHD itself, so that you can sort of go forward in your life knowing what your strengths and weaknesses are without blame, really, from the ADHD, and look back at your past and come to terms with some of the difficulties you've had and experienced in your life to enable you to make changes and feel better about yourself. So this video is all about one of the big stages that all women go through if they reach the age of their 50s, and that's the perimenopause and menopause. And this is a particularly significant period of time for those with ADHD, because it's often, in my experience, when women start to really struggle. And I've had many women newly present with ADHD because the menopause has made their ADHD symptoms significantly worse, and we'll touch on why that is in a minute. So what's the menopause compared with the perimenopause? Well, once a woman enters a menopause, it means that they've not had a period for a whole year. So no period at all for an entire year. But the episode of time coming up to that, called the perimenopause, is when your ovaries start to shut down, essentially, and as a result of that, production of estrogen and progesterone is in more fits and starts. Your periods can actually get heavier or lighter and become more infrequent or less regular, and it can be associated with the typical symptoms of menopause, which will be in the next slide. But that period of time coming up to your menopause, when you haven't had a period for an entire year, can be very tricky, particularly for women with ADHD, and it can last for up to 10 years. And this period of time often coincides for a woman with being in that sort of sandwich generation, where you've got youngish kids who need your support and help, you've got older parents who perhaps might need some more support, or even sometimes caring needs. And at the same time, particularly with our generation, you may be at the top or going towards the top of your career. And so some of the difficulties that people with menopause can get, with the sweating and with the brain fog and word finding difficulties, can really impact on your work functioning, your self-esteem, and can then have a knock-on effect on other areas of your life. When a woman enters menopause, the time is often linked to when their own mother went through the menopause. It's really useful to ask your mother when she did go through that change, and you can then get an idea of when to expect it yourself. Not always, but it can be helpful. Most women go through the menopause in their sort of 50s, but sometimes it can be from your 40s onwards, and some ladies with premature ovarian insufficiency can have it much younger, sometimes even in your 20s, although it's rarer. It can then be, because no one's expecting it, much harder to diagnose unless somebody's thinking more broadly about your difficulties and asking specifically about your periods and so on. So I'll move that over there. What are the common symptoms of menopause? Well, I've just talked about these sort of mental changes, difficulties in word finding, and that in itself can make women worry that they might be going through some sort of dementia, particularly if they've got a history of dementia in their family. Emotional changes such as anxiety, so often you can wake up feeling physically anxious in your chest and your stomach, but even though nothing seems to have particularly changed in your life. Having palpitations in your heart, difficulty sleeping with new onset insomnia, waking up in the middle of the night, can't get back to sleep. These sort of really unpleasant hot flushes that come on very abruptly, seemingly out of the blue, sometimes associated with sweating. Reduced libido, that middle age spread of increased weight. It can affect your skin and your hair with skin itchiness, dryness. Women can get recurrent urinary tract infections. Because we've got receptors for estrogen throughout our body, including in our gut, in our brains, but also connective tissue. Often people who are going through the perimenopause start to get muscle and joint aches and pains, which can be so severe that they end up in the wrong clinic, like the rheumatology clinic, and if not thought about, get misdiagnosed fibromyalgia or other rheumatological problems, which can lead to inappropriate treatment that doesn't actually improve things, and worsening headaches and migraines. Women going through the menopause, because their estrogen levels drop, their collagen in their body starts to get less effective, and so you can get some incontinence, particularly if you've already been through quite some severe childbirth trauma, and that can get worse with incontinence when you cough, or urge incontinence that you really need to go to the loo and you can't wait, and that can all be very difficult. And then the other thing that happens is that the ADHD gets worse. So we know that when your estrogen levels drop after you've had a baby and when you go through the menopause, because the estrogen levels in your brain affects the dopamine levels, what happens is that your ADHD symptoms get more obvious and more problematic, with increases in sort of impulsivity and emotional dysregulation, as well as disorganization. So if we look at these three graphs here, the top graph shows you what happens with all your hormones in a normal 28-day cycle in a pre-menopausal woman. So what happens is your estrogen levels increase up to ovulation and then drop, and that's commonly when some people with ADHD find that the last sort of week and a half or so before their periods start, their ADHD symptoms can get worse. But this is a sort of, for most women, a regular cycle. And then when you hit perimenopause, what happens is the estrogen and progesterone levels are a bit all over the place, like this. So rather than have this sort of smooth curve over the 28 days, it's like a sort of with splutters and stops and starts as your brain is trying to signal we need more estrogen, we need more progesterone, but your ovaries are running out of it. And then the third graph down here shows what happens when you are actually in menopause itself. So the estrogen and progesterone levels are flat, they don't change at all, and this 5 years prior to this, the cutoff is this sort of closer look at the perimenopause, the fits and starts, trying hard to squeeze out as much progesterone, estrogen it can, until eventually it has completely run out and there's no more left. And once that's happened for a whole year, that's when you've officially hit your menopause. But as I said before, this period of time here can last up to 10 years. And that's a big chunk of a woman's life, particularly at a difficult point in their life, potentially in terms of their career and their family. So in summary, women with ADHD particularly need to know about symptoms of perimenopause and menopause, and need to know that the ADHD symptoms are likely to get worse, and thus it's really important that they're aware of that so that they can seek appropriate help at that time. So in terms of what we can do to help, hormone replacement therapy. Now, hormone replacement therapy has had some rough publicity. Actually, HRT is pretty safe, and all we are looking to do is replace what was already there rather than add in anything different. There's a GP called Louise Newson who is very passionate about championing the importance of women getting appropriate education and help their menopause, because having HRT replacement is generally, for most women, a really good thing in terms of their future health. It will reduce your chances of having a hip fracture, which in your 80s can be fatal. It will certainly make you feel younger and can really stop that feeling of brain fog, the anxiety and the insomnia. So it's really important that you look at all your options and think carefully about it. Louise Newson has a free to download app called the Balance app, where you can monitor your symptoms for a month against your periods, and that's quite helpful before going to visit your GP, so that you've got the information. She also has a really helpful questionnaire called the Balance questionnaire, and that looks at all the symptoms you might get in menopause, and you can rate how severe they are for you. And taking that information to your GP can be, really help you have a much more productive conversation with them about your next steps. That if you've got ADHD, then you may find that having an ADHD medication review is helpful, because you might need a short-term increase in your medications at that time to help ameliorate some of the difficulties you have. Workplace support. Most workplaces now, particularly in large organisations, will have an awareness of how difficult it can be for women working with the menopause, and will have some things that they might be able to help you with. For example, fans, and ensuring you get time off without any problems to go and have reviews with your doctor. In addition, and alongside HRT, we know that those basic strategies that help with everybody's mental health have a particular importance at this time for improving the lives of women and making them feel better with their difficulties. And that includes good sleep hygiene, so not getting particularly overly anxious about if you're not sleeping, which can make insomnia much worse. Ensuring you've got a good diet, fresh fruit and vegetables, having regular exercise, even if that's something as small as going for a walk with your friends once a week, can really make a difference. Yoga, I'm a real fan of yoga because it's a great mind-body connection exercise, and everybody can do yoga, whatever their size. And nowadays, with park yogas happening for free during the summers, throughout the UK, you can access that to try it out. As I always say, it's not just about the pills, it's about making sure that all aspects of your mental, physical and emotional needs are met to ensure that you feel as good as you can. So in summary, going through the menopause is something we're all going to face if we're lucky enough to live that long, and most women are nowadays. It's really good to be prepared, to know what you're going to be facing, and so that you've got a plan in place, and you're not going to hit it in the dark, really. As I said, there are really good apps out there. The Louise Newson free Balance app can help you to think about whether you might be going into the perimenopause period, and you can ask your mother when they went through the menopause, and that can help you decide whether, yes, this might be a thing and you need to go and get some extra help. If you've got ADHD, it's even more important that you know about the menopause and how that might be affecting you, so that you can, if you've not been diagnosed with ADHD, you can seek help for that. And if you have had ADHD, you can let your ADHD clinician know about it, so that together you can adjust your medication for that to optimise how you are. So finally, we come to reflections, which connects us to the Women's Guide to ADHD Mastery booklet that you can complete relevant to this in there. If you haven't yet reached menopause, perimenopause, and how can you plan for it in advance? What do you need to do that would be helpful for you? And if you have reached menopause, what did you notice about the interaction between this and your ADHD symptoms at the time? And what actions do you want to take now going forwards? I hope that was helpful. Take care, and I look forward to seeing you at the next video.